Welcome to Learning Thursdays. I'm Dean Hale with the OASAS Learning and Development Unit and your host for today's presentation. Today's presentation is titled Motivational Interviewing, Not Magic or Manipulation. And joining me today is Paul Warren, Research Project Director at the Division on Substance Use Disorders, New York State Psychiatric Institute, Department of Psychiatry at Columbia University Medical Center. Paul is a senior trainer and curriculum developer and a member of the Motivational Interviewing Network, MINT. But first, a word about Learning Thursdays. Learning Thursdays are offered to behavioral health professionals as a free learning opportunity with the goal of improving the knowledge and skills of the New York State substance use disorder workforce as we strive to improve the lives of individuals needing prevention, treatment, and recovery services. A goal of Learning Thursdays is to support the professional development of the treatment, prevention, and recovery workforce. We do this by offering regular presentations that are relevant to today's substance use disorder treatment professional. As always, if there are any questions, comments, or suggestions, please feel free to contact us at the Learning Thursdays mailbox. You can use the same mailbox to express an interest in providing a future Learning Thursdays program. And now it's time to start the presentation and welcome our presenter.
Thank you very much, Dean, for that introduction and for the overview of Learning Thursdays. I want to thank you and OASAS for the opportunity to come back to Learning Thursdays and have this hopefully interactive learning community conversation about motivational interviewing. And I'll start with a little bit of a housekeeping detail, which is that I don't have any disclaimers to offer in regard to this particular presentation. I will add one other detail about my experience, which is that I am a social worker by training. And as Dean mentioned, I am a member of the Motivational Interviewing Network of Trainers. And I just wanted to add that as part of your understanding of my particular perspective and where I'm coming from. Sometimes when engaging in the conversation about motivational interviewing, it can be beneficial to actually start with what motivational interviewing is not. So in order to begin in that particular place, I have devised a simple true or false set of questions that I'd like all of you to consider. And basically, I will show you a question, let you come up with your own answer. I'll pause for a moment to let you come up with your own answer, and feel free to write it down if you want to, or carry it in your mind, whatever works best for you. And then we'll discuss the actual answer to that particular question. So the first question is, client-centered counseling and motivational interviewing are the same. Is that true? Or is it false? And I'm going to give you a moment to answer that for yourself. Client-centered counseling or person-centered counseling and motivational interviewing are the same. All right. The answer is false. They are not the same. They have a relationship, but they are not the same. And often people confuse the two and determine that because they're doing client-centered or person-centered counseling, that they are actually practicing motivational interviewing. And they are not. And hopefully by the conclusion of this particular conversation, that will become more clear. I'm going to make a statement and then move on to the next question, which is that it is possible to be doing person or client-centered counseling and not be practicing motivational interviewing. It is not possible to be practicing motivational interviewing unless you are also engaging in client or person-centered counseling. So what I'd really like you to take away from that is that client-centered counseling is the foundation upon which motivational interviewing sits and grows from. And they are not the same. Here's the next question. Stages of change and motivational interviewing. Stages of change is an important part of motivational interviewing. And again, You may know the stages of change model as the trans-theoretical model developed by Prochaska and DiClemente. Stages of change is an important part of motivational interviewing. False or true? The answer here is false. Stages of change is a model of looking at the overall process of change, and you may be familiar with pre-contemplation, contemplation, preparation, action, maintenance, and resumption as the stages of change. That model helps us to understand where somebody is in their process of change. It is not part of motivational interviewing, nor is it important to motivational interviewing. Having said that, stages of change, the trans-theoretical model, and MI were published, came out basically at around the same time. So they are often seen as kissing cousins. Stages of change, as I said a moment ago, is a way of thinking about the process of change, and motivational interviewing is a method of communicating, talking about change, and building motivation for change. So stages of change, although it's helpful to understand the process of change when practicing motivational interviewing, is not MI, nor is it necessarily important to motivational interviewing. Next question. Motivational interviewing is something I'm already doing. I just don't know the technical words. Is that true for you, or is that false? It's oftentimes when people attend training about motivational interviewing, they say, oh, yeah, I do that. I'm already doing it. I just didn't know that that's what I was doing. So is that true for you, or is that false? And what I would invite you to consider, because whether it's true or false, however you may determine that for yourselves, is what I'd like you to consider, and I'll say this later as well, that motivational interviewing, as we know, is an evidence-based practice developed by Bill Miller and Stephen Rolnick, and it is verifiable, meaning if I'm having a conversation with someone who's considering change and someone's making an audio recording of it, we can listen to that audio recording and we can use a validated coding instrument to determine A, if I'm practicing motivational interviewing, and B, how effectively am I doing motivational interviewing, and C, what are the strengths that I'm bringing to the conversation and where are the opportunities for growth. So people are often under the impression that they're doing motivational interviewing because they're using some of the core communication skills. And we'll talk about that as we go forward. It is possible to verify the actual practice of motivational interviewing. So oftentimes what people think is MI actually is more along the lines of person-centered or client-centered counseling. Go to our next and final question, which is, motivational interviewing is an evidence-based method of communication to motivate people to change. Is that false or true? And trust me, I want to be honest with you, I am not creating a trick question here. None of these are trick questions. So just keep that in mind. Motivational interviewing is an evidence-based method of communication to motivate people to change. That sentence, as it is written, is actually false. And it's false because of to motivate people to change. And let me be very clear about the distinction that I'm making here. Yes, motivational interviewing is an evidence-based method of communication. We know that. The purpose of MI, though, is not to motivate people to change. It's to engage in a specific, intentional conversation to help people to find and strengthen their own motivations to change. So, in essence, the person is motivating themselves. We are simply helping them to discover their motivations, and by employing those motivations during the conversation, We're helping to strengthen them, in addition to helping that person look at their ambivalence about the change that they're considering and helping them to resolve enough of that ambivalence so they can then move forward with what they think might be the next step to move toward that change for them. So this statement, as it's written, is actually false, because MI is not about motivating people to change. It's about helping them to find their motivation, strengthen that motivation, and then work with them collaboratively to figure out what they want to do next to move toward that particular change. So thank you for indulging me in participating in that true or false, false or true set of questions. And I'll also invite you to consider an article that was written by Bill Miller and Stephen Rolnick, which is called "The 10 Things MI Is Not." And the reason I think that they wrote this article is partly because of the stages of change, trans-theoretical model confusion that a lot of folks had. And it was very difficult for folks initially to really wrap their heads around what actually is the practice of motivational interviewing. And like I've used with these brief 4 questions, they really felt it was helpful to lay out for people, these may be the things you're familiar with. They are not motivational interviewing, and they also talk about what motivational interviewing actually is. And we're going to do the same thing as we go forward. It's important to keep in mind, and considering this, that since MI is not a way to motivate people, it's not a way to get people to do what you want them to do, what you think they should do, or what you're telling them to do, or what you know is best for them to do, well, then why do it? Well, the reason to practice motivational interviewing is because the evidence actually shows that when we engage in an MI congruent conversation about a particular and specific behavior change, we can actually help a person to find, strengthen their motivations, resolve their ambivalence, and move toward that particular change. And again, I think it's important to pay attention as you look at this particular slide that we cannot use motivational interviewing as a way to get people to do what we want. A lot of people think, oh, great, motivational interviewing is kind of the magic bullet. It's the way I'm going to get this person to stop using. It's the way I'm going to get this person to keep that appointment with their medical provider. That's not how MI works. So it's not a way to get people to do what you want them to do, what you think they should do, what you're telling them to do, or what you know, given your training or your experience, is best for them to do. Ultimately, motivational interviewing, and we'll talk about this in greater detail when we talk about MI spirit, really is a way to help that person to figure out what direction they want to go in, identify what is moving them in that particular direction, and then supporting them to come up with their plan about how they want to move forward. So, as we move from what MI is not, let's look into the foundations of motivational interviewing. And these are the broad strokes of what I'd like you to consider as we explore this practice. And remember, it's not magic. It's not a magic bullet. And it is not a way to manipulate people. Manipulation, confrontation would be considered MI inconsistent behaviors. So it can be helpful for us to begin with these broad strokes to build on some of the specific elements of motivational interviewing. But let's start with these broad strokes. This is a definition of motivational interviewing, and you'll see that there are 5 check marks here. Before we get into what the check marks say, I want to draw your attention to the bottom of the slide where it says evidence-based and verifiable. At the last time I heard Dr. Miller, Bill Miller, talk about this, there were over 1,700 scientific studies that provided evidence for the effectiveness of this particular method of communication about behavior change. My understanding from a colleague that I have the great opportunity to work with, Dr. Kate Speck, that there are also 200 clinical trials that provide evidence for the effectiveness of motivational interviewing. And you may remember that I said earlier that MI is verifiable using there are a number of validated instruments, but using a validated instrument to code someone's practice when using motivational interviewing. So let's look at these 5 check marks and let's walk through this sort of concise and yet very clear definition of the practice of motivational interviewing. And I'm emphasizing the practice of motivational interviewing, which I'll come back to as we go forward in this conversation. So first, it's a client-centered conversation. And you'll see that the word conversation is bolded here and it's in italics. It's critical to underline that because the tone with which you want to be engaging in an MI conversation is that it's a conversation. And that means if Dean and I were having a conversation, Dean would say something, I'd be listening to what Dean is saying, and then I might reply to what Dean is saying. So first and foremost, it needs to be a client-centered conversation, and it's between 2 collaborating partners. Now, don't misunderstand me. That does not mean that you still don't have the training, the lived experience, the expertise that you have. What being a collaborative partner means is you're bringing your expertise to the table and you're inviting the person you're in the conversation with to bring their expertise into the conversation. So it's 2 collaborative partners working together. And I'll frame that another way. That's the stance that we want to take when we're engaging in this client-centered conversation, that we're a collaborative partner with this person. The MI practice conversation focuses on a specific behavioral change about which the client feels ambivalent. They're of 2 minds about it. I'm thinking about wanting to make this change, and there's a part of me that's thinking about not wanting to make this change. Therefore, I'm ambivalent. Now, I'm going to pause here because I want to underline, if there's only one thing you take away from this entire conversation, and my hope is that there'll be more than one, but if there's only one thing you take away from this conversation, my hope is that you will take away that the practice of motivational interviewing views ambivalence about a behavior change as an opportunity. It's not a bad thing. Ambivalence about a particular behavior change. I want to cut down the amount of alcohol I'm consuming. There's a part of me that doesn't want to make any change at all. MI sees that and takes that in as an opportunity to engage in this specific, intentional, and selective conversation about that particular behavior change. So again, the one thing that I'd like you to take away from this, if that's all you take away from it, is that ambivalence about a behavior change from the MI perspective is an opportunity. So during that conversation, the worker is intentionally guiding that conversation. And they're guiding that conversation to stay focused on the behavior change. Now, there's not a rigidity to that, but there is an energy to it. And I want to make a distinction here, because sometimes people think, well, I'm client-centered. I let the client talk about whatever they want to talk about. And that's great. That's client-centered, person-centered counseling. MI is saying we are intentionally guiding the conversation to invite the person lead the person, guide the person to explore their ambivalence about that behavior change and to discuss their desire to make the change, their ability to make the change, their reasons to make the change, or their need to make the change. And you'll notice DARN spells darn. So we invite that person to talk about those things, and we'll talk about that in greater detail as we go forward about why that kind of language is so important. But the worker is intentionally guiding the conversation to do that. And during that guided conversation, we're exploring the ambivalence of being of two minds or multiple minds about I want to, I don't want to. And we're also identifying and hopefully increasing the clients or the participants or the peers' personal motivations to consider the particular change that we're talking about. Now, that's a pretty concise, clear, and I'll use this word, recipe for the practice of motivational interviewing, for it to constitute, equal, add up to the practice of motivational interviewing. All 5 of those check marks need to be there. So just keep that in mind when we're talking about the practice of motivational interviewing. So, you know that I mentioned earlier that ambivalence is an opportunity. Now, there's a definition of ambivalence on this particular slide, and I'm going to suggest that you not read that definition, as difficult as it may be because the slide is in front of you. But I'm going to say, please do not read that definition. And I'm going to ask you to think for yourselves about if somebody asked you, hey, Dean, what does ambivalence mean? What would you say? How would you define ambivalence? So some people define it as being on the fence. Some people define it as not being able to take an action. Some people define it as having very strong feelings or having no feelings about either direction. So it can be a combination of all those things, but generally speaking, ambivalence is not moving in any one direction or the other. It's about being in a particular, almost stuck or on the fence place. Now, keep in mind when we're talking about ambivalence, we know it's an opportunity from an MI perspective. It's not free-floating general ambivalence. It's ambivalence about a specific behavioral change goal. Okay, so it's ambivalence about cutting down the amount of alcohol I'm consuming. It's ambivalence about using clean needles. It's ambivalence about whatever behavior change that the person is considering. Okay, now, before we go to the next slide, I'm just going to also ask you to think about for yourselves. And I wish that I could see you, because I would say, if you've ever felt ambivalence in your life, go ahead and raise your hand. You don't have to tell us what it's about, but if you're listening to this broadcast, this recording, and you've ever felt ambivalence in your life, go ahead and raise your hand. Now, I'm raising my hand. You may not be able to see it, but Dean is raising his hand because he's here. So if you've ever felt ambivalence in your life, raise your hand. Now, I'm going to operate on a hunch here. If I could see all of you, and I wish I could, and I hope we will see each other at some point, but if I could see all of you, just about 99.9% of the people that would be participating in this conversation would have their hands raised, because just about everybody has experienced ambivalence about something. Now, keeping that in mind, consider this. Ambivalence is very common. It's something that is part of day-to-day life. It's normal. It's part of a human experience. And let me underline these last 2 check marks. It is part of a change process. So if someone is considering change, if you have the opportunity to be sitting across from somebody who's considering change, chances are There's going to be that opportunity ambivalence there. And that's a good thing. And ambivalence is not the same thing as resistance, because resistance means no way, no how, not now, maybe never. Ambivalence means, well, there's a part of me that wants to, and there's another part of me that doesn't want to. And again, from the MI perspective, that is an opportunity. So you may recall that I said that the ambivalence that we have the opportunity to engage in a conversation with the person about is about a specific behavioral change goal. I want to underline, it's not this free-floating ambivalence. It's ambivalence about a specific behavioral change goal. And let me give a concrete example here. If a person comes in and they say to you, hey, Dean, I want to change this. This is the plan that I have in mind to do that, and I'm going to start doing it at this particular date. Guess what? That person is not ambivalent. They've made a decision. They're thinking toward a particular plan. And guess what? You don't need to practice motivational interviewing with them. So I want to underline here that motivational interviewing is not for every conversation. And let me be even more specific as I say that. The practice of motivational interviewing is not for every conversation. Somebody who's not ambivalent, you don't need to practice motivational interviewing. Okay? And you can really think of this behavioral change goal, and I'm an amateur astronomer, so I framed it as that MI has a North Star. Because as you know, the North Star is always in the same place in the sky, and it's for many centuries been used to guide people. And when we're engaging in the MI practice conversation, the behavioral change goal is the North Star. It is what guides us in the conversation. It helps us to stay on track, and it helps us to intentionally use the tools that we have to explore the ambivalence about that behavioral change goal, and to help identify and strengthen the motivations about that behavioral change goal. So you can always think about, and you can always go back to the behavioral change goal as the North Star guiding the MI practice conversation. Now, I have a video that I'd like us to watch together. It's a fairly brief video, and I'll just set this up before we watch it. And you may think, well, why the heck are we going to watch a video about a dentist? Well, the reason we're going to watch a video about a dentist is because MI can be used in many different situations, and this is a wonderful example of not using motivational interviewing. And it's a very helpful tool to point out a few things. So it's a conversation between a dentist and her patient after there's been an exam. And I'd like you to simply watch this video. And then when we come back, I will ask you a few questions about it. And I'd also like to state here, and I'll probably restate it after I ask you the questions, I'd like to state here that this video and its companion video, which we will also look at during this conversation, its companion video can be very helpful tools to develop a deeper understanding of the practice of motivational interviewing. So having said that, just watch the video. Stay open to what your take on the conversation is, how you might feel if the dentist was interacting with you this way. And when it's finished, we'll come back and I'll ask you a few questions about it. So we will go ahead and show the video now.
Both dentists and hygienists have opportunities to counsel patients about oral health related behaviors. As a dental professional, you have a responsibility to talk to your patients about tobacco use and how it affects their oral health. However, it is important to keep in mind that the way you approach your patients about this issue will have a big impact on how your advice and concerns are received. In general, it is not useful to confront or lecture your patients about their tobacco habits, as this approach is usually not well received by patients and may interfere with your ability to counsel them effectively. Watch what happens as this provider becomes more and more confrontational in her warnings about tobacco use and her advice to quit smoking.
Okay, so I finished the exam. Have some good news and they have some not so good news. Looks like you don't have any cavities, so that's the good news.
That's great.
However, I'm pretty concerned about something I'm noticing in your mouth. Actually, if you look up here, the roof of your mouth, I'm noticing a lot of irritation that's really consistent with tobacco use. And you had said on your form that you're not a tobacco user, so I'm just wondering what's going on.
I don't smoke cigarettes.
Okay. Well, as I said, there's a lot of irritation. In particular, like I was mentioning, up here in the roof of your mouth, it's turned really deathly white colored, and there's little red spots. And you probably didn't notice because we don't spend a lot of time looking at the roof of our mouth. But you're really damaging this tissue in your mouth, which can really cause some severe problems in terms of your oral health. It's called nicotinic stomatitis, and this is something we don't see in any patients who don't use tobacco. So maybe you're not smoking cigarettes. Are you smoking a pipe or cigars, or is there something else that could be contributing to this? Because I don't know what else might be causing it.
Well, the only thing, I've never smoked cigarettes, ever. But when I go out with my friends, we like to go to, we like to go out to lounges and sometimes there are those nice young men that gift you different sorts of things, and we got some of those mini cigars, Swisher Sweets. They come in peach and grape, and that's the only time that really, I've ever really used anything that's got tobacco in it.
Okay, so I think that's a pretty common misconception because they're fruit flavored. People think they're okay. Those are really bad for you. Did you know that?
Really bad, but they're just cute little girly cigars.
Right. They're still cigars, and they're still tobacco, and so they still cause lung cancer, oral cancer, emphysema, all those same kinds of things that you would see with cigarettes.
Well, I only
really
use
important.
them just to relax. I mean, it's not like it's something that I would smoke 20 or 30 cigarettes a day. I mean, I only do it when we go out.
Well, at least you're not doing that, so that's good. But it's still causing a lot of problems, and as I said, I can see the evidence in the roof of your mouth. You're causing some serious damage, and this needs to stop. Have you thought about quitting?
Well, I didn't really know I'd started.
What do you mean?
I didn't really think that it was anything more than just like social drinking. Just something that I do in a social setting when me and my friends go out to the bars.
So you're going to quit then?
Maybe.
What do you mean maybe? I just told you how bad it is for you. It's messing up your mouth. You're putting yourself at risk for all these other diseases. This is really important. You need to quit.
Well, it's something that I'll have to think about.
What's there to think about? You said it's not something you do all that often. There's all these negative side effects. There's all these risks that you're putting yourself in.
Well, it's just something that I do to relax, and I don't do it that often, and so I probably could cut back.
Okay, well that's a good start, but cutting back isn't going to do it. If you actually quit the smoking, you can reverse all the damage you've done in your mouth, and you can stop yourself from being at risk for these other diseases. But as long as you're continuing to use these cigars, you're really putting yourself in a lot of danger.
Well, I don't believe that they're cigars. And what I do believe is that it's a choice, and it's my right, and it's something that I choose to do. And so I will think about cutting back, but I'm not at a point where I'm ready to do that. And I'm not really sure that I even believe that what you're telling me is real.
You're choosing to really damage your mouth, and actually it can cause problems with your teeth too. I don't know if you noticed your teeth might be getting yellower than they were before. That's another side effect. There are a lot of really negative things that go along with any tobacco use, whether it's cigarettes, cigars, dip, chew, snuff, snooze, hookah, any of it. This is a really important decision that you're making, and you said it's your choice, but you're really choosing to make yourself sick and potentially die.
Well, it's something that I'll think about.
Well, I appreciate you thinking about it. I hope you'll think about it really hard. You know, this is something that I'm going to continue to ask you about because it's something that really needs to change.
As you can see, the more the provider pushed the patient to quit smoking, the more withdrawn the patient became. What might have been a good example of comprehensive oral health counseling quickly turned into a power struggle, with the provider growing more frustrated and the patient becoming defensive and asserting her right to continue smoking. Too often, we try to talk our patients into changing their ways by giving them a lot of information about the risks associated with their behaviors. This usually is not a successful approach because we are generally not able to engage the patient in a fruitful discussion this way. Instead, we should focus on eliciting our patient's own personal reasons for change.
Well, thank you for watching that video, folks. So you'll see here that there are 3 questions. And before we get to those questions, before you ask yourself, before we get to that particular place, what I'm going to invite you to think about is, and what I'm going to also ask you to do in regard to this video and its companion video, is focus on the dentist. I know it can be very tempting to want to focus on the patient, but I'm going to ask you to focus on the dentist. And what I'm going to ask you to notice and make a disclaimer about from the very beginning is that video that you saw was not the practice of motivational interviewing. And let me repeat that. That video that you saw was not the practice of motivational interviewing. Okay? So now you can ask yourself, and again, take a moment and really ask yourself this question. Does the dentist care about the patient? Now, what I would imagine is there are some people that are going to definitively say, absolutely not, no way, doesn't care at all. Some people are going to be a little bit ambivalent about it. They're going to be on the fence, like, well, she kind of does care. She took a lot of time. And then there will be some people that say, yeah, she does care, but she's kind of a tough love kind of dentist. So I ask you to just think about that for yourselves, what your experience/impression was. The second part is, what is the impact or outcome of the conversation? So if you think about, and this is where I am asking you to think about the patient, what do you think the outcome of the conversation with the patient actually was? And I will throw out my 2 cents of that the patient feels attacked, perhaps, disrespected, and feels the need to defend herself. And again, I invite you to draw your own conclusions about that. And then the last question is, would you go back to this dentist? And again, there are some of you who may definitively say, no way. And some people also say, I would have got up in the middle and walked out because it was so, it was so over the top. She was so aggressive. And the other thing that I'll throw out to you, yes, we know this is a training video. And ask yourself, have you been spoken to this way, or have you observed providers speaking to patients or clients this way? So is it really realistic? And again, when I've shown this video to other folks, they say absolutely. It's absolutely realistic. So keep that in mind, and I'd like you to consider this dynamic that Bill Miller and Stephen Rolnick have identified, and they've put a name to it, which can be very helpful. When a client feels 2 ways about a situation, and again, we know that means they're ambivalent about it, and they express that ambivalence to the helper, the provider, the peer, often what can be switched on for that person is the desire to keep that person from going down the wrong path. And I want to normalize. That's a normal human response. And I will add another detail about that. If you are a peer, a person with lived experience, and you bring that to your work, If you're a professional, which peers are a kind of professional, if you're a provider, a social worker, a counselor who has lived experience, that is a benefit, and you may be subject even more strongly to this particular dynamic because you've lived where that person maybe is right now. And that switch may be very strong. Well, Miller and Rolnick actually call that the writing reflex, the desire to make it right, fix it, solve it. And I have a definition that I'm going to share with you. And I want to underline, that's a human reaction to ambivalence. We care. We got into this work because we care. And as you saw in that video, if you thought at all that the dentist cared, her caring got in the way of providing service to that woman. In fact, her caring was so passionate, I'll use that word, so intense that it potentially drove the lady with the pearls out of care. It's possible that that lady went out and smoked another cigarillo and didn't ever go back to the dentist. And that's because of the way the dentist cared so much. So here's the definition of the writing reflex: the desire, the wish, the intention, the impulse, or the action or actions to fix, solve, rescue, save, and or spare the person. Keep them from falling into that same hole. And again, it's normal. We all have it. And I'm going to editorialize for just a moment and say, for myself, and I've heard many other people say this writing reflex never goes away. We're human beings. It never goes away. When we practice motivational interviewing, we learn how to manage it so it doesn't get in the way of being able to have an MI practice conversation. So let's make a transition from those broad strokes into three core parts of the practice of motivational interviewing. And again, this is really an opportunity for me to make a distinction before we explore these parts, which is much training about motivational interviewing spends a great deal of time helping folks to understand these core parts of motivational interviewing. Remember, motivational interviewing is an evidence-based practice. So the distinction I want to draw here, I'm sharing this information with you, and I'm sharing it with you in a brief manner. I'm sharing this information with you, and it's helpful for you to understand this, and your understanding, your intellectual mastery of this in no way will guarantee that you can practice motivational interviewing. And let me be even clearer about that. It's wonderful to know this information, and in order to implement, practice, or use motivational interviewing, this information has to be operationalized. You have to actually do it, because understanding it is not the same thing as doing it. So the first of the three core parts to understand is something called MI spirit. I'll add that for me, this was probably one of the most elusive parts of the practice, only because it took me a while to conceptualize why it was so important to overtly state this. Because I fancied myself as a social worker as being very client-centered or very person-centered, and MI spirit is very person-centered. I've come to understand that when we practice motivational interviewing, MI spirit really guides the way we want to be when we're in that conversation with the person. So first and foremost, we want to be a collaborative partner, and you may remember that from the brief definition that I shared with you. We also want to accept the person. And let me be specific about what acceptance means in MI. It means that we acknowledge that the person sitting across from us has absolute worth as a human being, no matter what they've done or no matter what they're doing, that they have the capacity within them to come up with solutions and motivations in order to move toward the change that they're considering. It also means that we affirm strengths and efforts that they're making. And it means that we also respect their autonomy, their ability and the power that they have to decide, yes, this is the direction I want to move in, and yes, this is the action I want to take, or no, this is not an action I want to take. And the last of the 4 A's of acceptance is something called accurate empathy. And basically that means we strive to understand accurately and on a feeling level this person's experience. We don't assume just because we've worked with somebody who's considering cutting down the amount of alcohol that they're using, that this person's motivations, their experience is going to be the same. So that's what acceptance means. Compassion is really putting that person's welfare above our own agenda. And then evocation is drawing out the motivation and the solutions or suggestions or steps forward from the individual. You combine those 4 elements and they equal what is called MI spirit. And again, this is the stance, the way we want to position ourselves when we're engaging in the MI practice conversation, or when we're interacting with someone in an MI, using an MI consistent approach. And I'm going to say more about MI consistent approach as we go forward. The next one is called the 4 processes. And again, take this in, folks, let this wash over you. Try not to get too caught in the weeds about these particular details. But the 4 processes can be very helpful because they guide what it is we're doing with the person, the work that we're engaging with them on. And you'll notice that engaging is the first step of the 4 processes. First and foremost, before we get to any of the treatment plan, before we get to, what brought you here today, we want to engage and make a connection with the person. Once we've done that, we continue to engage because it's the platform of the work that we're doing. And then we do what's called focusing. And that's where we identify the behavioral change goal, if there is one, because keep in mind, there isn't always one. So we would identify the behavioral change goal. Now, evoking, and you'll notice that that was an MI spirit as well. Evoking is truly the unique and critical difference with motivational interviewing. And it's funny because when people are learning and using motivational interviewing early on, it's a step that they often jump over and they jump right to planning. Evoking is where we invite that person, guide that person to talk about their desire to make the change, their ability to make the change, their reason to make the change, or their need to make the change, or to offer their commitment to the change, or to identify the steps that they're going to make, or the plan that they have for that particular change. And evoking is critical to the practice of motivational interviewing because it's where the ambivalence is somewhat resolved and the motivation is identified, and the power and powers of that motivation then move the person toward planning. If this were a longer conversation, we could have a very long discussion and practice opportunity about identifying when somebody is ready to actually make a plan while you're practicing motivational interviewing. Unfortunately, due to the brevity of this particular conversation, and maybe there can be a future conversation, we'll just leave it at there are signs when you've been evoking that somebody is ready to make a plan, and then that's the time to really talk to them about what is the plan, what are the steps that you might want to take, and let's collaboratively put that together. So that's what we do. And then what I like to think of as the rock stars of motivational interviewing are OARs. And these are the tools you use when you're practicing motivational interviewing: open-ended questions, affirmations, reflections, and summaries. And keep in mind, folks, Bill Miller and Stephen Rolnick did not invent the open-ended question, the affirmation, the reflection, or the summary. What they did do very successfully is come up with this great acronym, OARS, as a way to help people to remember to use these tools. Now, I'm going to say this later, and I'm going to say it first here. Using an open-ended question, offering an affirmation, a reflection, or a summary does not equal the practice of motivational interviewing. It simply means you're using those tools. These tools are not exclusive to motivational interviewing. So again, folks, keep in mind, these are the tools we use. These are skills that we can practice, refine, and become proficient at. The use of them without the other elements, the other ingredients in the recipe, does not equal the practice of motivational interviewing. Now, last big core element is that remember, it's a guided conversation. It's directional toward that North Star, toward that change goal. And and you'll notice the big type here, is not directive. If you're telling somebody what to do, you've crossed a line and you're engaging in incongruent behavior. So in we don't want to tell folks what to do. And this can become a very complex conversation, partly because of the writing reflex, the desire to want to help the person fix the situation. And it can become a complex conversation because the program or the agency may have a particular goal that needs to be attained or an agenda. And again, if this were a longer conversation, we could take this apart more and really explore that using specific examples. What I'd like you to consider, though, is overall, we are not telling people what to do. So just keeping that in mind. So we've talked about some of the really broad strokes, some of the core components of motivational interviewing, and now we're going to talk about motivational interviewing actually in action. So one of the ways that can be helpful to become more acquainted with motivational interviewing, refine your practice of motivational interviewing, is to actually look at other people or listen to other people doing motivational interviewing. And the way that that can be done often is through audio recordings, and there are hundreds of them available online, and or scripts. And I have a script here that has a person in it named Conrad, and Dean and I are going to read this script together. And what I'd ask you to consider as Dean and I read this script is, overall, if you were going to describe this conversation, how would you describe it? This document will also be shared with you because after we read this conversation, we're going to talk specifically about some of the things that the worker said, because they are examples of consistent interaction. And we're only going to talk about a couple of those examples. And what I'd like you to consider doing is going through the entire transcript on your own or with colleagues and identifying what is the worker doing when the worker is speaking to Conrad, because there's an intentionality to it. So I'm going to share my screen and bring up this document. Dean has graciously agreed to read the part of Conrad, and I'm going to read the part of the provider. And I'd like you to just listen to that. And again, think for yourself, what are your overall impressions of this conversation? And then we will talk a little bit more specifically about what the worker is doing. So I am now going to share my screen and bring up that document. Hi, Conrad. It's good to see you. Thank you for making the time to come in today and to talk about smoking. Tell me about how smoking fits into your life right now.
If I could, I'd have a cigarette right now. Yes, I would, because I like to smoke.
You came in to talk knowing you weren't able to smoke. That takes commitment on your part.
Yes, but you need to understand that my whole life is based around a cigarette. When I get in my car, I smoke a cigarette. Even though I can't smoke on the job, I take breaks during the day. In the old days, I used to be able to smoke anywhere. It was a lot easier then. But yeah, if I could have a cigarette right now, I would.
Smoking is a big part of your life right now. What are some of the good things about smoking?
It relaxes me. You know, I hang out with my buddies at break. I've been doing it all my life.
Is it okay if I ask you another question? What are some of the not so good things about smoking?
Damn, it's expensive. My family's bugging me, my doctor, everywhere I go, smoking is a problem. And it's harder and harder to find a place to smoke in peace.
If it's okay with you, I'd like to summarize to make sure I understand what you're saying. Some of the not so good things about smoking right now is that it's expensive. It's harder and harder to find a place to smoke. Your family, your doctor are all bugging you, and you just want to find some peace.
Yeah, I really want some peace. I'm so tired of people telling me what to do. But right now, I have no intention of quitting.
Right now, you have no intention of quitting. I just want you to know it's up to you if you decide to cut down or quit.
What do you mean? You're not going to try and make me quit like everybody else?
No, I'm not going to try and make you quit. I appreciate your willingness to talk about this, and I respect your right to decide what's right for you.
I want these people to stop bugging me and tell me what to do.
The goal you want to achieve is peace. You want people to stop bugging you, and you don't want to be told what to do.
Bingo. You ain't never lied.
Would it be okay if I asked you another question? Tell me about how you want to accomplish this goal of getting peace. So folks, thank you for listening to that scenario. And you got to meet Conrad, and you may recall I asked you to think about your overall impression of the conversation. So again, formulate those thoughts in your own mind, okay? Now, what I'd like to suggest is that brief part of the conversation, because it would have gone on further, using that script, we can look at what the worker said, and we can intentionally identify what skills the worker is using, what parts of MI spirit the worker is using, and where the worker may be in the 4 processes of motivational interviewing. So I invite you to go through the entire script yourself. And what I'm going to do is show the script one more time and just take you through a few, maybe 2 or 3 of what is referred to as the utterances of the worker. And we'll just take them apart in terms of how they are expressing and demonstrating the use of motivational interviewing. So if we could go ahead and take the slides down just for a moment, and I'm going to bring the transcript back up. All right. So folks, we're looking back at let's say the first 3 volleys, what the worker is saying to Conrad. And again, I'm going to walk you through this to point out the intentional use and practice of motivational interviewing. So I'll read what the worker said. Hi, Conrad. It's good to see you. Thank you for making the time to come in today and to talk about smoking. Tell me about how smoking fits into your life right now. So we could say that the worker is intentionally engaging Conrad, affirming that it's good to see Conrad, thanking Conrad for making the time to come in and talk about smoking. And then, so that's part of the MI spirit, that engaging the person, and then using an open-ended question. tell me about how smoking fits into your life right now. And again, you'll notice that that open-ended question, hopefully I demonstrated it effectively by it not being judgmental or negative. It's just trying to understand, trying to get a sense of how smoking fits into Conrad's life at this particular point. So Conrad answers, and you can read his reply right here. And then the worker says, you came in to talk knowing that you weren't able to smoke. That takes commitment on your part. Now, that is an affirmation. And the worker is framing the effort that Conrad made, showed up for the appointment, knowing that he couldn't smoke, that he's committed at least to having this particular conversation. Now, Conrad answers that with talking about the role and the place that smoking has in his life. And this is how the worker responds. And I'll just bring that up. Worker says, smoking is a big part of your life right now. What are some of the good things about smoking? So technically that would be called a reflection. So Conrad said all of that information about how important, how much he likes to smoke, and the worker has very intentionally and selectively boiled it all down to smoking is a big part of your life right now, because the worker doesn't want to repeat all those details. And then followed that with a very unexpected and intentional open-ended question. What are some of the good things about smoking? And the reason that the worker is using that, and that's called the first half of the decisional balance. And when you read through the scenario again on your own, and hopefully you'll take the opportunity to do that, you'll see that the second half of the decisional balance are what are some of the not so good things about smoking. But the reason that the worker asks this intentional open-ended question about the good things is because the worker is trying to understand and also build rapport. Because Conrad is probably, and this is confirmed at the end, of the mind that this worker is going to tell him to quit. And of course, we know, because we heard the scenario read, that the worker does not do that, because that would be MI inconsistent behavior. So I just wanted to walk you through those first three utterances of the worker so that you could really think about the intentionality and the selectiveness of the practice of motivational interviewing. So I'm going to go ahead and stop sharing. We're going to bring the slides back up and go forward. So folks, again, I've mentioned with that scenario, we can really look at intentionality, and we can also look at selectivity, which we'll talk about in a little bit. So we're going to go ahead and go back to the companion video of the dentist. Again, given what you've hopefully taken away from the scenario that we just read, this companion video is a demonstration of the dentist actually practicing motivational interviewing. So what I'm going to again ask you to do is think about the core skills that we talked about: open-ended questions, affirmations, reflections, and summaries. And as you watch this particular video, put your focus on the dentist and keep in mind that the dentist is intentionally choosing the skills and the tools that are being used, and is intentionally and selectively guiding the conversation. So again, just watch the video with that in mind, and we will come back. I'll say a little bit about the video, and then we will go forward.
Watch what happens this time when the provider asks the patient for her view of the situation and follows up by talking about what's important to the patient and why she might want to make a change.
Okay, hard part's over. So the good news is no cavities.
Oh, hooray.
Yes, always happy to hear that. I do have some concerns though, because I'm seeing some irritation in your mouth and the palate that's called nicotinic stomatitis.
Oh, that sounds bad.
Yeah, it is. It's some damage to the roof of your mouth that happens from tobacco smoking. And so I'm wondering if you can tell me a little bit about how tobacco fits in your life right now.
Tobacco? I mean, I don't smoke cigarettes. I've never smoked cigarettes. I do go out with my friends. We go out to bars and, we'll have a few drinks and smoke some of those little cigarillo type things. I mean, I don't even think of them as cigars, and they're certainly not cigarettes. And I mean, I'll have one or two of those in an evening with my friends, but certainly not 20 or 30 of them a day like you would with cigarettes. And that's the only thing that could possibly have anything to do with tobacco.
So you've made a decision in your life not to smoke cigarettes. That's something you didn't want to do. It sounds like you're kind of concerned about the health effects of cigarettes. But you have been smoking the little cigarillos, at least one or two every time you go out.
Right, but that's just like a social thing. That's something that my friends and I do. It's not a habit or something that I have to have, and we're talking about one or two when we go out for an evening, not packs of them.
Yeah, so you're not like those chain smokers. You're not smoking packs and packs a day.
No.
The amount you smoke is so minuscule you can't even imagine that it would cause any harm, and yet here it is damaging the roof of your mouth.
Well, you have a point there. Now that you mention it, I have started having one or two at work, when we have breaks, because I have a couple of friends at work that smoke. And so every time we have a break, we all go out to the break place outside. And so I go with them, and I have one of these Swisher Sweets. I like the peach flavor the best. They're so cute. But that's really only pretty recently.
So smoking has kind of become a big part of your social life now. When you go out, you're smoking, and even during breaks at work, you're smoking.
Well, yeah. Now that you say it like that, it's true. I am smoking on a daily basis.
So aside from that social aspect, what are the things you like about it?
Well, it's relaxing, and it's just nice to be with people. When, I like to go to Las Vegas. And so when we go to Vegas, it's really fun to go to the cigar bars. It's kind of sophisticated and fun. And so, it's mostly a social thing.
Okay.
I mean, I wouldn't say I was a chain smoker.
Okay. How about the other side? Have you noticed any not so good things about the smoking?
Well, I was going to ask you about whitening my teeth, because I've noticed that they have more stains on them than a few years ago. And so I imagine that has something to do with the smoking.
Yeah, so we're noticing some pretty negative effects in terms of your oral health with the smoking. Are there any other things that you're concerned about?
Well, there's the expense, what with the economy and all, I've had to be careful about my money. And so there is the extra expense of, because I'm buying more of them than I used to. So the money aspect is also a concern.
So there's your oral health, there's the financial aspect, and then earlier you brought up some concerns about smoking cigarettes and how that can be harmful for you.
Oh, yeah.
Were you aware of the fact that smoking these little cigarillos, the Swisher Sweets, can have some of the same negative health effects?
Oh, absolutely not. I mean, I thought of it more as a fun thing to do with my friends, certainly not a smoking habit or anything that would be harmful.
So it's kind of surprising to you that something you've been doing, and you've been doing more and more of it, is actually pretty bad for you.
Oh, yes. I checked the box on your form when you asked if I used tobacco. I checked no, because I never thought of myself as a smoker.
Well, what do you kind of make of that now that you realize that you're actually a tobacco user and that you might actually be causing some pretty serious health effects.
I'm really concerned. I mean, I don't want to develop cancer, lung cancer, or any of the awful things that happen from smoking. And, really, until this conversation, I never really thought of myself as a smoker at all. So I'm very concerned.
Well, the good news is, in terms of the nicotinic stomatitis, at the point in which you stop smoking, you can actually reverse all the negative effects that occurred. And you might also know that you can stop the progression of any other diseases that had started just by quitting smoking.
Really?
Yeah, is that something you'd be interested in?
Oh, I would. I really would. Because, like I said, I'm a brand new smoker. I didn't know I was a smoker until I came to see you.
Well, if you think about it on a scale of 1 to 10, where 1 is really don't think you could do it at all, and 10 is really confident that you could quit if you tried, where do you think you fall?
Oh, I think I'd probably be in 7 or 8. I'm pretty confident that I could stop doing this.
Okay. What made you choose 7 or 8 as opposed to a 5?
Because it's not a part of my daily life. I don't have to have a smoke when I get up in the morning. I don't smoke 20 or 30 of them a day, so it's not that much exposure, and I'm pretty confident that I could stop.
So it sounds like, just to kind of summarize, you've noticed some negative effects of the smoking. You have some concerns about health effects that could occur. There's the financial aspect, and yet you feel pretty confident that you could quit if you tried. So where do you think we should go from here?
I'd really like some more information about quitting. I mean, I've heard there's some new medications, there's some new things that can be done to help people make quitting more comfortable, and I really want to quit.
Okay, well, I'd be happy to talk to you more about that and give you some tips and advice and give you some suggestions about where you can get some support with quitting.
Oh, that'd be wonderful.
I really appreciate you talking to me about this today.
Thank you.
Instead of jumping in to confront the patient about her tobacco use, the provider allowed the patient to tell her story. Where some providers might interrupt the patient, she made effective use of pauses throughout the interaction, giving the patient a chance to respond fully. In addition, by reflecting on what the patient said, without being judgmental or accusatory, the provider gave the patient an opportunity to be honest regarding her situation. This invited an open and collaborative discussion between the two. During this interaction, it was obvious that the patient felt that she and the provider were on the same team. As a result, she seemed comfortable working with the provider to find a workable solution.
So folks, thank you so much for watching the video. And again, like the Conrad script that we used, I'd like you to consider that this video can be a wonderful tool that you can use similarly to the script to really go through utterance by utterance of what the dentist said. And again, folks, let me just reiterate that an utterance is simply what the dentist is saying, followed by the utterance of the patient. But we're specifically looking at what the dentist is saying because they're the one practicing motivational interviewing. And you could use this video to go through utterance by utterance and identify what tools, what of the 4 processes, where they are in the 4 processes, and how MI spirit is being manifest in the conversation. So just keep that in mind as another tool that can actually be used. And there are many others, but these are just 2 that I'm selected for our conversation that may be helpful. Now, we said earlier that MI is intentional, it's also selective. And let me give a concrete example of that. And actually, I'm going to go back to the Conrad script to do this. And you may want to go back to the Conrad script and look at it yourself so you can see it. I mentioned it earlier, but I want to underline it again here, which is Conrad gives a whole paragraph early on in the conversation about how much smoking is a part of his life and how he's always been doing it and how often he does it and who he does it with. And the worker's utterance, their response, is to take all that detail that's actually supporting Conrad smoking and justifying why he smokes. The worker takes all that detail and boils it down to a reflection. Smoking is a big part of your life right now. That is intentionally being selective. And let me underline why that is a great example of selectivity. If the worker summarized every one of the points that Conrad made and specifically restated them, that ultimately would reinforce Conrad's attachment to smoking. And when we're practicing MI, we don't want to do that because that would just reinforce what Conrad is already doing. So the worker intentionally and selectively boils that whole statement down because she wants Conrad, or he or they want Conrad to know that they're listening and that they're trying to understand, and the worker doesn't want to reinforce the smoking behavior. So that's a great example of intentionality and selectivity joined together. So as we start to conclude this conversation, let's focus a little bit on MI skills and MI proficiency. So overall, consider, and this is probably stating the obvious, that how you interact with somebody, how you approach them, can really have a pretty significant influence on the outcome of that person moving toward change or remaining where they are. We can actually influence people. And it's interesting because some of the early research that Bill Miller did really focused and identified how workers engaging in specific and particular ways actually improved outcomes. And that was the foundation on which motivational interviewing was actually built and has been refined. You may remember these tools: open-ended questions, affirmations, reflections, and summaries. Remember, I said earlier, just using these tools does not equal the practice of motivational interviewing. They are the tools that we use, and we do want to develop proficiency using them, and we want to marry that proficiency, that skill, that ability to intentional and selective practice of motivational interviewing. Now, I alluded to this earlier, but I wanted to take a moment to draw a very particular distinction here between the ideas of MI consistent approach, which is interacting with somebody, engaging somebody in an MI spirited way, engaging in partnership, accepting them, offering compassion, and evoking or drawing from them. That would be what is considered an MI consistent approach. The thing that makes it MI practice is when there's an identified behavioral change goal, that the ambivalence can be explored, resolved to some degree, and motivations can be identified and strengthened. There is a difference between these two concepts, MI consistent approach and MI practice. I mention that difference not to cause confusion or to get you deeper into the weeds of motivational interviewing. I mention it because I want you to know and to consider that you can engage with somebody in an MI consistent way, even if there's not an identified behavioral change goal. In fact, if you choose to do that, there's a greater opportunity that you may actually find and be able to pursue a behavioral change goal. So I just want you to keep in mind the importance of the MI consistent approach and how we would continue to use that in MI practice when there's an identified behavioral change goal. Now, there is really one path to proficiency with this evidence-based practice of motivational interviewing, and it's practice, practice, and practice plus something else. So what I would really like to encourage everybody who is participating in this learning community conversation is, if you really want to be able to use motivational interviewing to support the change process of the people you have the opportunity to provide services with. Continue to participate in learning community conversations about motivational interviewing. Continue to listen to audio or start listening to audio recordings and reading scripts. And find trusted colleagues or supervisors that you can practice this with, because ultimately the path to proficiency is through practice and through getting feedback and coaching and becoming a member of a learning or practice community. And I want to give an example of the last bullet. I've had the great opportunity of working with a colleague, in addition to a few other colleagues, for over 12 years, practicing motivational interviewing. We meet, we either go through a transcript together or we engage in a role play together, and we practice motivational interviewing and offer each other strengths-based feedback. And we sometimes code each other's practice and offer, using a validated instrument, and offer strengths-based feedback to each other. I really want to invite you, if you are serious about implementing, refining your ability to use motivational interviewing, practice, 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 and seek out feedback, coaching, and or become a member of a learning or practice community about MI and focused on MI. So it's important for us to probably revisit this idea of ambivalence, because there is another and an additional critical component of motivational interviewing that, if I were to leave it out of this conversation, I would be remiss. And I've alluded to it, I've referred to it a couple of times, and I want to overtly give you the opportunity to focus on this during this Learning Thursdays conversation, which is what I'd like you to imagine in your mind at this particular moment as we move into this concept, is I'd like you to imagine a gold coin and see that gold coin in your mind's eye. And what I'd like you to consider is that gold coin has two faces. It has one face, and if we flip it over, you can see the other face. And what I'd like you to imagine as you imagine the gold coin that you have in your mind's eye is I'd like you to see one face, what's on that one face, and then I'd like you to flip it over and see what's on the other face. And I want to support your autonomy to put on the coin whatever you want, but see the coin as having two faces. Now, when we're talking about MI and we're thinking about that gold coin in MI, on one face of that coin, there is something called change talk. And that's any speech, anything that the client says that favors the movement in the direction of the change, the behavior change that the person is thinking about. And let me give a concrete example. The person is considering cutting down the amount of alcohol that they're consuming. And they might say something like, yeah, I'm thinking about doing this because if I get another DWI, I'm probably going to lose my license. That would be considered change talk. And in MI, that would be under that umbrella of darn, desirability, reasons, or need, because the person is considering this and their desire is to keep their license. And when they utter that speech, they're offering change talk. So that's one side of the coin. Now let's go to the other side. That's called sustained talk. That's anything that the client says, any speech that they give that supports or defends or maintains the considered behavior. Now, the considered behavior in the example I gave is the person is considering decreasing the amount of alcohol they consume. Again, that's a harm reduction change goal. And in MI, harm reduction is acceptable. So that's the change they're considering. They just gave us some change talk. if I cut down the amount of alcohol I'm consuming, I might be much less likely to get a DWI and avoid losing my license. That's the change talk. They follow that with, I don't know how I'm really going to do that though, because, I hang out with my buddies on the weekend and, I don't want to lose those friendships. They're really important and we drink together. That would be sustained talk. That is something that the person is offering that's helping to maintain their drinking behavior. They're both valid. They're both real for that person. They are both part of the two sides of that gold coin, and they are the language of ambivalence. And remember, we said the one takeaway that you have from this conversation is that ambivalence is an opportunity. So I want you to understand that both sides of that coin are normal. When we practice motivational interviewing, we are choosing intentionally to soften the sustained talk and to employ the change talk, to use the change talk. Again, we could spend another 90 minutes or 6 hours really focusing on how to do that, how to soften sustained talk, how to employ change talk. And if you're practicing motivational interviewing, you're going to want to learn how to do that because that's what will make the practice successful. And I want to give you an example that go back to an example that we've already talked about that is softening sustained talk. Remember Conrad, the smoker? Well, Conrad gave that whole speech about how important and how big smoking is. The worker did a reflection and softened the sustained talk by not repeating all the details and simply saying, smoking is a big part of your life right now. That affirms that the worker heard and is trying to understand Conrad, and it's not reinforcing the sustained talk. So this is another area that we could spend a lot more time in, and perhaps in the future we'll get to do that, because this is really getting into the refined practice of motivational interviewing, the skill and ability to soften that sustained talk and employ the change talk to build and strengthen motivation. So you may remember the writing reflex. And as a way of concluding our conversation today, I wanted to repeat it, to go back to it, and really talk about why the writing reflex is so wrong as an approach. Now, the reason I framed it that way is I want to normalize yet again. We care. We do this work because we want people to get better. We want them to heal. We want them to achieve their life and health goals. And we are tempted, because we're fellow human beings, to want to fix, solve, rescue, save, and or spare that person. It's normal. We all have it. And when we practice motivational interviewing, we do the best that we can to acknowledge that we have it, but we don't want to act it out because it's normal to have the desire to fix, solve, or rescue. But let's acknowledge it and try not to act it out. And we have a wonderful acronym as a way to help us to acknowledge it, but not act it out. And before I talk about that acronym that will help us, it's important to keep in mind that the reason we don't want to act out on the writing reflex is because if we do, sometimes what that will do is evoke more sustained talk. It will invite the person we're talking to start justifying why they're doing. Well, it's my choice and my right. And you may remember the lady with the pearls says these 3 things. That is the dentist evoking the sustained talk from the lady with the pearls because she is acting on her writing reflex. Now, the other thing that you saw in that first video was that the dentist created discord in their relationship. It broke down because the dentist was trying to solve, rescue, fix, save, and tell the lady with the pearls what to do. So we want to avoid evoking more sustained talk or creating discord. It happens, and we can course correct, but we want to do our best to avoid it. So the way that we can course correct is to use this acronym RULE, R-U-L-E. You may have noticed that motivational interviewing loves acronyms. Sometimes they're helpful, sometimes they're overwhelming. So hopefully you'll have a copy of this slide deck and they won't be overwhelming because you'll have a key of reference to go back to. So I'd like to share this acronym with you. R, resist the writing reflex. Acknowledge it. Give yourself grace that you're a human being, and of course you care, and of course your impulse would want to be to save, fix, resolve. Acknowledge it, don't act it out. Put your energies into understanding your client's motivation or motivations. And probably the best way to do that is to reinforce your efforts to listen to that person, and you can empower that person. And let me be very specific about what empowerment means in motivational interviewing. Empowerment means creating the space for that person to make their choice, to exercise their autonomy. That's what empowerment means in motivational interviewing. The person is empowered to identify their change goal if they have one. The person is empowered to consider what actions they may want to take when creating a plan to address their change. The person is empowered to identify their motivations for considering this change, not why we think they should do it. So again, this acronym can be really useful, and it can be a way that we kind of take care of and are kind with ourselves about our normal desire to want to fix, rescue, or solve. So having left you with that acronym as a final place, I cannot say thank you enough for participating in this learning community conversation. And I sincerely want to thank OASAS and Dean Hale from OASAS for inviting me to be part of this learning community conversation and to share something that I'm really passionate about with the substance use disorder workforce. And by all means, if there are any comments, if there are any questions, this is my contact email. You should not hesitate to reach out to me. And again, I want to thank Dean and OASAS for this really special opportunity. So thank you so much for that.
I want to thank Paul for joining me today. Great information and skills for working with folks. I hope you all find it useful while assisting clients in need of services. Your feedback's important to us. It helps us to know if we're meeting your educational goals and expectations. Once you've viewed the presentation in its entirety and completed the quiz, please follow directions to access the SurveyMonkey website and take time to complete the evaluation, including suggestions for any future topics for Learning Thursdays. Once again, thank you for joining us and keep up the good work.